Hello, it's your fashionable midwife. How is your weekend going? Hope everything is fine. Today no we go. Didn't go out, so let me just leave my head like this. How are you doing? I think the last time I came, I talked about the interpretation of your abdominal scan in pregnancy, and I mentioned one of uh, the things that you can see, the presenting part. So I'm here today to show you how the presenting parts look. I got a baby. I call this my baby Oju Telegon. So I want to use this baby to describe the fetal presenting parts. That's why I brought it here. So if you are here or you come across this my video later, please help me to like it. You can share it, no problem. Hope your day is going fine. So that day I talked about the presenting part. It's about three. We have the cephalic, we have the bridge, and we have the transverse line. Before 38 weeks, the baby can still change position and come out in whatever position it's presented. But the most commonest presenting part is the cephalic. That's vertex, the edge. That is the one that will present first. And that one means the baby's head will be down while the legs will be up. While in breech, the baby's head will be up. The buttocks or the leg may be presenting. While transverse is, the baby lying horizontally across your uterus. Look at this baby. Let me use it for the example so that we'll understand it very well. If it's cephalic, this is the head of the baby. So inside your womb, the baby will lie like this. This one I can't bend the leg, but some of them, the legs will be well flexed, but the baby's head will be down. So this is cephalic and is the most commonest presentation in pregnancy. If it's before 38 weeks, the baby can still change. But if by the time the head is already engaged, that is the part that the baby will come out from the mother's vagina. Then if it's breech, the head will be up like this. This is the baby. The baby may be sitting inside the womb. The head will be up. The baby will present the buttocks. That even when the midwife comes, if the client is in labor and the midwife trying to check her, when she wears her glove, when she puts her glove hand into the vagina of the woman, what she will feel is the soft part of the buttocks. Sometimes we even feel the baby's feces. We call it meconium, the first stool of the baby. You will see it, although it's not too normal for a baby to be passing meconium. It's a sign of fetal distress, but you can see a little part of it. So the baby can sit, or the baby will be presenting. We call it footling breech. So you will see the baby presenting with the legs. So breech can come in two forms, the buttocks or the legs. Then talking about the transverse, the baby will be lying horizontally across the woman's uterus. So this is transverse. The legs will be here, the head will be here. And there's no way the woman can deliver vaginally with this kind of presentation. Most time, this one we head in cesarean section. Even breech sometimes. Yes, with experienced midwife, I've delivered breech so many times when I was still working in Kebbi State. But if you don't want any complication, the birth plan may be with your healthcare providers, with your doctor and your midwife. Some breech can also be delivered vaginally if you have experience midwife. But there's something that the doctor and the other healthcare personnel can do when they see that maybe your baby has always been in breech for a very long time or transverse. There's what we call external cephalic version. So they will try to turn the baby to the normal presentation that will be easier for you to have a cesarean section if there are no issues, if there are no complications. But I used to say that it's only years ago that people get scared of cesarean section. If that is what will make your baby to be alive and you to be okay, you can discuss it with your health care provider, your doctor, that I think it's better I go for CS. We call it elective CS. We have known even before the day of delivery that you are going for CS. But in case of like this transverse, whether you like it or not, there's nothing they can do. If at 38 week, 37, 38 week, your baby is still lying like this horizontally across your uterus, definitely you are going to go for cesarean section. And especially my tribe Yoruba, they fear this bridge. We call it Ige. Ẹsẹ̀ ló fẹ́ mọ́, ẹsẹ̀ ló fẹ́ mọ́ wáyé, Ọlọ́run má jẹ́ kí n bímọ tó máa pa mí. So people are always scared, of of them knowing that they are going to deliver a breech baby. Please, if you call me, you can just help me to like this live streaming. Thank you as you do so, and God bless you. So what I have here is that at 38 weeks, baby can present in several ways. Though the ideal and most common is a cephalic head first presentation. I said that cephalic presentation of why the head will be down, the legs will be up, is the most commonest one. In most time when the woman is about 37, 38 weeks, it's always the cephalic. And you see the baby, you at least you must have seen the pictures of a baby inside the womb where the baby will be well flexed, the head will be down like this. And if it's breech, it will still be flexed, but it may be presenting the buttocks or the legs of the fetus, and we call that footling breech. Other possible presentation include breech, buttocks or feet first, then shoulder, that is transverse line. Then this cephalic also, we have face presentation and brow presentation. Yes, the baby is coming with the head. This is the head of the baby. If it's cephalic, just like I told you, it will be down like this inside the uterus. Let me move back so that you see it. So you see the head now. This is how the baby will be inside the woman's womb. This is cephalic, and it's the normal position that is very common that most women deliver with. But there's another thing, that even this cephalic, you will see some of these baby, they are presenting their face. You will think she wants to come and see something. She will, instead of the head to be well flexed, it will just present like this. The face will be the first thing that will come out during delivery. We have face, we have a brow presentation. Why the breech? The breech will be like this. The breech will be like this. The head will be up like this, while the legs will be down. And this part of the body, the buttocks, can be presenting when you do your VE. Or I've seen a case that it was one leg that first of all came out even before they came to the hospital. In fact, the color of the leg had already changed, because they came from a very far place, from a very rural area. But thank God the baby was asphyxiated, but with our efforts and God, the baby later survived. So women go through a lot. It's not that pregnancy, even delivery, a lot of things can go wrong in the labor room. I've seen cases of women that came into the labor room and they never came out again. They died. They brought their corpse out, because anything can happen. I've seen a case of a woman that delivered normally. That time the doctors were on strike, and she started bleeding, postpartum hemorrhage. Oh my God, I've never seen that kind of blood in my life. The medical department, they were on strike. The lab, nobody to to get her blood, to get pint of blood for her, for us to save her life. So what I did that time, my husband was still alive, and he used to have a private clinic in the town. But before we could get there, the woman died inside the car. It was very painful. I think it was her 8th pregnancy. And postpartum hemorrhage also, one of the causes is atony uterus, where the uterus cannot contract very well because it is already flabby. And that's why most time we tell them that you should do family planning, because we only have one uterus. Even if I have only this top, or I have only one wrapper, I'm using it day in, day out. One day it will get I love children. It's God that give me, God will take care of them, but you have to consider your health first. 8 children. I don't think in this Nigeria now there are people that will still be having up to 8 children. Maybe the people in the village, maybe the children are not going to school. But in this present economic situation, you don't have to be told that. You need to plan your family, plan your life. Do that. So I think I've explained that here are the different types of presentation. Cephalic, we also call it vertex presentation. The baby's head is the presenting part, which is the optimal position for vaginal delivery. Breech, the buttocks of feet, just like I said, lead the way through the birth canal instead of the head. Then the shoulder. The baby is in transverse sideways lie, with no part of the fetus in a position to enter the pelvis. When we say the baby the presenting part is already engaged. During palpation, when a patient comes for antenatal clinic and we are trying to check our abdomen to see, when the pregnancy is already 38 weeks, then this part of the body, if she's presenting with cephalic, we engage and enter into the pelvic brim, ready for labor to start anytime. So when we palpate, we will just feel part of it. We will know that it's already engaged because we need to fill our data. So we will write there that presenting parts engaged. But if it's a case of transverse or shoulder presentation, there's no way that part of the baby can engage. It cannot enter into the pelvic brim because this is how the baby is lying down in the woman's uterus. So it's not possible for it to get engaged. In fact, most times you see that it's shoulder presentation. If it's this shoulder, there's no way the baby can come out. So most time it will result in obstructed labor or prolonged labor. So to be on the safe side, I think most doctors will prefer to prepare her for cesarean section to be on the safe side. And I said also that cephalic, the baby's head is hyperextended, meaning the head is tilted back like this. So that's face presentation, the one I was explaining that time. The head will be, instead of the head to be well flexed, it will be tilted back, extended back like this. So the baby will be presenting with its own face. Then the brow, the baby's head is partially extended with the forehead or brow be the presenting part. This is your brow. So while most babies are in the held down position by 36 weeks, and many settle into that position by 38 weeks, it is not possible for other position to occur. Just like I said when I started, that if the baby has maintained that same presenting part for a very long time and is now 36 weeks, the baby cannot change its position again. But before that time, maybe before 34 weeks, the baby can still change the position because the baby, moves around to find the most comfortable position for it to stay before labor will start. So, but if it's entered at 38 weeks, honestly, there's nothing they can do, except if you have an experienced doctor that can do external cephalic vision, where the babies will be turned into normal position so that when the woman falls into labor, she can just deliver vaginally. There are about 6 of you. Only one person liked it. Please, can you just like this live streaming? I know you are enjoying it. Thank you and God bless you. I appreciate your coming. So, you could disappear. Okay. So that is it. Abnormal presentation require careful management. In midwifery or medicine, when it's cephalic, we believe that it's the normal presenting part. But breech and trousers, we call it abnormal presentation. And that's why the abnormal presentation require careful management, as some can lead to difficulties during labor and may necessitate a cesarean section. If your baby is lying or presenting any abnormal parts, that could be an indication for cesarean section. So even if they tell you in the hospital that you are going to go for CS, please don't panic. Please don't stress yourself. Don't let your BP jacked up. CS within minutes is done. And few days after, if you are the type that gets ambulated early, you will get over it and you and your baby will be fine. So don't let fear overpower you. Fear, you see, if you are the type that gets afraid easily or you get stressed, it's that same fear that can make someone to die before it's time. So please take it easy and just know that these are the commonest presentation before birth. Okay, if you look at this picture in this my phone, see, if you look at that picture, you see that the baby's head is down, just like the way I explained with that my doll, that the head will be down. So that is it. It's one of the, in fact, it's the commonest and the normal position for a baby to present. We call it presenting part or presentation of the baby. The head is down and that is cephalic. But as the baby grows, the baby can change. So if you are getting closer to your exciting due date, you might have had your doctor or midwife mention the term cephalic position or cephalic presentation. This is the medical way of saying that the baby is bottom and feet up with their head down near the exit or birth canal. So when you hear your or healthcare providers, your midwife say, the baby is presenting, it's cephalic, is this, is that. So, you still continue coming for antenatal clinic. You will do scan. From that scan, they will even know that this is what the baby is presenting. So the last time I came live, I talked about how to read your scanning results in pregnancy, and I talked about PP, that is presenting part, what the baby is presenting. I talk about AF, amniotic fluid. I talk about last menstrual period, LMP. I talk about EDD. I explained that EDD is the date given to you that you will deliver. If they give you September 7 that you will deliver, that does not mean you will deliver on September 7 gongon. It may be 2 weeks before that September 7, or 2 weeks after September 7. And I said in that video that it's always good for you as a pregnant woman to always ask questions. Don't just go to hospital, they just give you a result and you are going home without knowing what was written or what is written inside it. You need to know everything. You are the one carrying this baby, so you need to really show interest. You need to, that's why I like in the developed country, when the doctor, the midwife, because the midwife, they are just like doctors. In fact, if a pregnant woman will see a midwife all through her pregnancy, unlike here that, most time we refer to doctors, midwifery there is a very great specialty area. So if she goes to her midwife for scanning, as she's doing the scanning, she will be explaining to her, this is your baby, this is the head, this is the heart. Can you see the heartbeat? Can you see the way the baby is lying? If you want to know the sex of the baby also, the midwife can tell you. So the midwife, they have that autonomy in developed country to, do scans, to do so many. But here in Africa, you see that most people, they say, it's doctor I want to see you. So then when they will, and when the pregnancy is advanced, sometimes in the antenatal clinic, we ask you to be coming every week, because we know that you are near your due date and you need to be monitored closely. So you'll be coming every week to check you. So if by that 36 week your baby is not head down, your doctor might try to do, just like I told you, that external cephalic version for the baby to be well rotated and to be placed in the normal position. And you should also keep it in mind that this baby's presentation can change. But if it does not change and it's your pregnancy now enter 38 weeks, then definitely that is elective CS that you can deliver through. Then I want to say something about breech. A breech baby can cause complication for both mom and the baby. This is because the birth canal has to open wider if your baby decides to come out bottom first. If it's the head, just like I did on the other app yesterday, if your baby is presenting cephalic, the head will be down. And the head will be exerting pressure on the internal os, and as the uterus is contracting, it's pushing your baby down for you to dilate more, for the baby to come out. But because this one, there's a score there, and that also will help propel your baby through the birth canal. But if it's the buttocks is just muscle, it's very soft. There's no way it can assist in more dilatation of the cervix, because the birth canal need to be widely open for the baby to come out. So if it's breech, that means the bottom will come out first, and it is even easier for the legs to come out first. But most time, breech presentation can cause delay, and this can affect the time of delivery. And I also told you that there are different kinds of breech position that your baby can be in. We have frank breech. This is when your baby's bottom is down and the legs are up straight like a pretzel, so their feet are close to their face. Beside, babies are definitely flexible, so breech is an abnormal presentation. That's how we call it in the hospital. But don't be anxious even when they tell you that your baby is presenting breech. Please don't be scared. Everything will be fine. Then we have complete breech. This is when your baby is settled into an almost leg crossed position with their bottom down. Incomplete breech, if one of your baby's legs are bent, like sitting cross-legged, while the other one is trying to kick toward their head or another direction. They are in incomplete breach. Then the footling breach, just like it sounds, this is one when or both baby's feet are down in the birth canal, so they could exit the foot first. So in the footling breach, you will see that most time the one of the legs will first come out. But with an experienced midwife or doctor, when we bring out the first feet, we can also bring out the second, and there's a maneuver we can do. Then we deliver one of the hands, deliver the second one. Then with our gloved hand, we go into the head will now be coming down. We now put it into the baby's mouth and just try to pull it down. And most time it's very easy. You see that the woman will deliver a breech without any complications. But it requires a lot of experience anyways. So transverse, just like I said, that one, there's nothing you can do much. Most time is cesarean. We recommend cesarean section. A baby that is lying horizontally across the uterus, there's no much you can do. So how can you detect this your baby's position? From the physical examination that your midwife performs and your doctor, they can tell that yes, this baby is not lying in a normal position. Then the ultrasound scan also provides an exact image of your baby and even which way they are facing. The ultrasound scan will tell you the true result of what your baby is presenting, the part that will be coming out, especially when the pregnancy has reached its full term, and anytime you could go into labor, the ultrasound scan will tell you that this is what the baby is presenting. Then listening to your baby's heart, it also gives, when when a woman comes for antenatal, we palpate and we listen to the fetal heart. Where we listen to that fetal heart will help us also to determine the presenting part of your baby. So if you're already in labor and your baby is not turning into a cephalic presentation or suddenly decide to acrobat into a different position, your doctor might be concerned about your delivery. And that's why you see some people, even in the developed country, they have what we call birth plan, where they can discuss with their healthcare provider, the midwife, the doctor, and other people, to say, with the situation, with the presentation of this baby, I think this woman, we can try her. She can give birth in vaginal spontaneous delivery, or no, don't let us try this. Let us book her for CS with your consent and your husband consent. CS will be booked and you will deliver. The most important thing is for your baby to be alive and for you to be okay, whether CS or vaginal delivery. We've seen people that deliver vaginally and they deliver stillbirth, and you see another lady deliver through CS, and her baby, as soon as they remove her from the uterus, the baby will start shouting. You know that this baby is very active. Then when you are trying, one thing about that cephalic external cephalic version is that when they are trying to do it, complication may occur. As they are turning it, the baby, the cord can just round the neck, and this could be complication. This could cause asphyxia in the baby. So the doctor will decide that this is the best thing to do is for you to do cesarean section for everything to be okay, to prevent further complications. So that's why the most time that transverse, they used to book the person for elective CS. Then there are some mind exercises that I see that some people can do, pregnant women can do, to even help in changing the position of the presentation of the baby. But no matter what you have done, if the last scanning maybe a few days or a day or even that day that you're having contraction and your baby is still in transverse presentation, please don't take the risk or breach. If you cannot stand it, if you just there are some people who call their baby precious baby, maybe somebody that has been trying to get pregnant for the past 6 years, for the past 8 years or 10 years, and now you want to she will say no, I will go for CS. And thank God, most CS now is local anesthesia. It's no more general anesthesia. You can see, but you will not feel the pain. They would have given you spinal anesthesia. You can see them removing your baby, but you will not feel the pain and everything will be fine. So these are just a few things I want to come and tell you this evening, and I know you've learned 1 or 2 things there. Thank you. If you come across my video, please like it, and God bless you. See you later. Bye.